Hi, my name is Oscar Piloto, and today we'll be discussing my case study on the boxer's fracture. So, our patient came in to get an x ray of her right hand and her right wrist. And the first thing we did was we checked her medical history to see if she had anything prior, and she had no history. So, we just began our questioning simply with a couple examples like, what are you here for? How did this happen? Have you taken any medications? Do you have a prior history of any past fractures or anything like that? And do you have any other manifestations? After she answered those questions, we moved on to removing the brace, and we removed the brace and inspected her right hand. Found it to be extremely swollen and discolored, so we immediately knew we needed to be careful with our procedure. And the majority of the swelling was found on her medial side of her fifth metacarpal. She had limited motion in her pinky and her wrist, and she explained how she was an MMA coach in a nearby gym and that this injury occurred in a sparring session the night before. So we began to take the x-rays, and we started with the hand. So we did a PA hand, an oblique hand, and a lateral hand. And then we moved on to the wrist, which was more difficult for her because she had difficulty bending her pinky, so we had to assist her, and we ended up taking a lateral and a PA. So the images revealed a suspected boxer's fracture and no fracture of the wrist. A boxer's fracture is a transverse fracture of the neck of the fifth metacarpal, and it accounts for about 20% of all fractures in the hand, but like more specifically in fighters or boxers, hence the name boxer's fracture. So a couple treatments for this is, there's reduction. They could do a closed reduction for the finger, rest, or surgery to implement screws to keep the finger aligned and in place. These are all options that would be next discussed. But we know that a lot of ice, pain medication, and rest will follow to lower the swelling and give the bone time to heal. In general, it takes about 6 weeks for a hand fracture to heal and another 6 weeks for it to further heal and gain strength. Occasionally, a loss of bone alignment occurs, and this may lead to the more, difficult procedures like inserting the screws. But if a fracture involves the joint, then arthritis may develop later in life. And because this injury occurs in the neck area of the metacarpal close to the MCP joint, this is something to consider, although it's not common. A boxer's fracture can also result in the loss of a prominent finger knuckle and may leave malrotation in the little finger, which weakens your grip strength. It'll say that when you close a fist, this pinky finger will overlap with the other one and weaken the strength of your grip. Ultimately, this injury should heal back to normal without too many further complications, as like I mentioned before, it usually doesn't affect the joint.